Hi, my name is Clara. I'm a nurse here at Sims Clinic and I'm here to show you how to prepare and to administer your Decapeptyl medication. Decapeptyl is a medication used to trigger ovulation to happen in advance of your egg collection procedure. Always wash your hands thoroughly in advance of preparing the medication and make sure your work surface is clean and tidy also. Have your medication out and ready to prepare in addition to your equipment also. So in this case, you will need anything between a 2.5 and a 5 ml syringe, a small needle and a big needle. You'll also need your medication, which in this case is 2 glass ampoules of powder and 2 glass ampoules of normal saline. The normal prescribed dose of Decapeptyl trigger injection is 0.2 milligrams. You'll notice in your medication, this is normally dispensed as 2 0.1 milligram ampoules. So to prepare the medication, you're going to take your syringe, and of the needles, you're going to use the bigger of the 2 needles. You'll attach the needle onto the syringe and you'll remove the plastic sheet from it. Now you're ready to prepare the medication. You're going to draw up the normal saline first. To do this, you're going to hold the normal saline in an angle and insert the needle into the glass ampoule. You're going to gently bring the plunger up to draw the water into the syringe. You're going to repeat this step and you're going to do the very same to take the water, the normal saline, out of the glass ampoule for the second time. Now that you've done this, you're going to add the water into the first Decapeptyl powder medication. So to do this, again, you're going to insert the needle in through the rubber bone and you're going to inject the water into the powder. Keep the needle in the glass ampoule and just allow a few seconds for it to dissolve itself. Once dissolved, you're going to tip the glass ampoule upside down to draw the water back into the syringe. With the second glass ampoule of powder, you're going to add the mixed solution from the syringe into the second powder. Again, just give it a few seconds for the powder to dissolve, and once dissolved, tip the medication ampoule upside down and you're going to draw the medication back into the syringe. So you are now ready to inject. Disinfect the area that you wish to inject. We recommend the lower abdomen, anywhere underneath the belly button. Give a gentle pinch to the injection site. Make sure to clean the area with a small alcohol wipe, and you're going to inject the medication at a 45-degree angle. Once you insert the needle, depress on the plunger to make sure all of the medication is administered. Hold the needle in place for just a few seconds before gently removing. Once you've done this, you will discard the attached syringe and needle into the sharp bin.